Hi, my name's Jennifer Wick, and I'm the Assistant Director of Pharmacy here at the Christ Hospital. Today, I'm going to talk a little bit about my own journey to board certification and how that became a part of my career. Now, when you come to see me most days, I am no longer wearing a white coat. Nowadays, I've transitioned, and you'll see me more frequently in a blazer. But that doesn't mean that board certification has lost its place in my life. And I think that my career can really help illustrate how board certification applies to a variety of roles. When I first started, I wasn't sure that I was going to go into a practice in a clinic. I wasn't sure what kind of pharmacy I was going to be involved in. But during my clinical rotations as a student, I had a rotation at an ambulatory care clinic for anticoagulation services and really fell in love with that longitudinal relationship with the patient. This led me to move into residency, which then really led me to board certification. When I started my first year of residency at West Virginia University, I was struck by how preceptors expressed their value of board certification. They really had a great opportunity to share how they had used their own board certification to challenge themselves to prove their knowledge, but then also have discussions with clinicians and patients what that board certification meant. They were using their board certification experience to talk about how mastery of clinical knowledge could really benefit patient care. And that's a theme that I saw at multiple institutions. As I went to my second year of residency and practiced at the West Palm Beach VA, this was furthered in a variety of specialties. So there, pharmacists were certified not only in ambulatory care, but also in cardiology, oncology, a wide variety of specialties. But they had one thing in common. Altogether, they valued their board certification, and it was something they were very proud of because it showed that mastery of practice that each of those clinicians had. So when I moved into my own independent practice here at the Christ Hospital Health Network in Cincinnati, Ohio, it was something that I pursued almost immediately. I was very eager to get my board certification to really show that I had mastered that same amount of content and that I was the content area expert for ambulatory care. Now, that also helped as we sought to expand services here at Christ. When I first started, I was the only pharmacist in our physician division. So many of our providers were not as familiar with how a pharmacist fit into the clinical practice model here. Many of them had never had a pharmacist in the office. However, they all had passed their own board certifications, and so that really served as a great focal point for how we were the same rather than different. I was able to talk to them about their own experience getting board certified and use that connection point to talk about how pharmacists were those medication management experts, about how we had proved our mastery of knowledge and were ready to apply that in the clinic setting with our colleagues, whether that be physicians, nurse practitioners, or other members of the care team. As we continue to expand, that's something that I also saw in other pharmacists that I was onboarding. So when I saw a candidate that has board certification, that really tells me that they have challenged themselves, that they have that mastery of knowledge, and that it's important to them, that the mastery of the knowledge in their practice area is something that they're really proud of. That's something that they have stamped on their own resume as a highlight. And that's something that's very important to highlight to me as well, because it does show that you have taken that extra step to show what you're capable of. As we moved into other clinical practice areas, that still held true. So while we were no longer adding as many positions in primary care, we had covered most of those offices, we started expanding in other specialties. So we added pharmacy in cardiology, in oncology, and in our musculoskeletal service line. In each of those instances, board certification in their respective practice area was very important because it helped show those clinicians that same mastery of knowledge that our system and our clinicians had come to expect with primary care. As we move forward, looking for those various board certifications continues to be important to me as a hiring manager, but I think it's also important for the staff. It really shows that they are valuing and passionate about that practice area, and they're passionate about showing others that they have mastery of that topic. Now, not necessarily everyone is going to stay in the clinic forever, although I did love my time in clinic, but nowadays you'll see me more frequently in a blazer, you'll see me more frequently in administrative meetings. And board certification continues to be important there. Those same skills that you had to have in order to pursue and achieve board certification, the time management, the investment, the passion about your topic area, those are all things that still remain important in management as you continue to strive for excellence in services. I'm always a big believer you shouldn't do anything unless you think you can be the best at it. And I really do think that we can offer the best pharmacy services and that offering board certified clinicians is a part of that. It's important to show the providers and our patients that we're offering them the best possible patient care And a big part of that is showing that we have clinicians that are as passionate as they can be about their topic area and also have that mastery of knowledge, which board certification is a very great conduit for. Now, you may wear a different kind of coat. Maybe you're still in a white coat, maybe you are in a blazer, maybe you're in a sterile compounding gown. But no matter what type of coat you're wearing as a pharmacist, your career can benefit from board certification. And so I want to challenge you to challenge yourself, challenge you to take on that goal of obtaining board certification, proving your own mastery of knowledge, and working hard to get that type of certification for yourself so that you can put that rubber stamp on your resume. Trust me, you won't forget it.